If you've ever had that patch of dry, itchy, inflamed skin that just will not quit, you know exactly how maddening it can be. So today, we're going to pull back the curtain on the world of eczema so you can really understand what's going on with your skin and what you can actually do about it. Right? We've all been there. A spot on your skin gets red, maybe a little bumpy, and just impossibly itchy. You try some lotion, you try your best to ignore it, but it just hangs around. It's so uncomfortable, and it leaves you thinking, what on earth is this, and why won't it just go away? Okay, so let's get right to it. The first thing you absolutely need to know is that eczema isn't just one thing. It's actually an umbrella term, kind of like a family name for a whole group of skin conditions. They might all look a little different, but they all share that same frustrating experience of inflamed, irritated, and itchy skin. So how do you know if you're dealing with it? Well, even though there are lots of different types, they do share some common features. But here's the key thing to understand. What eczema looks like can totally change depending on whether it's a brand new flare-up or if it's been hanging around for a while. And this really shows you what I mean. Over on the left, you've got acute eczema. That's a new flare, it's often red, swollen, and can even have these tiny little blisters that ooze or crust over. But on the right, that's chronic eczema. See the difference? After a long time of scratching and irritation, the skin literally thickens up, gets kind of leathery, and can even become darker in that spot. You know, when a doctor is trying to diagnose eczema, they're basically a detective looking for clues. They're going to ask about your age, what might have set it off, and whether it popped up suddenly. And the location? That's a huge clue. For instance, have you ever had an itchy rash right below your belly button? 9 times out of 10, that points straight to a nickel allergy from the button on your jeans. All right, now that we've got the basics down, let's zoom in on the most common type of all, atopic dermatitis. The easiest way to think about this one is as an inside job. It's mostly driven by things inside your body, like your genetics and your immune system. And it is so common. We're talking up to 20% of all children are affected, and for most of them, it starts before they even turn 5. The genetic link here is just massive. If one parent had it, their kid has a 56% chance of getting it. And if both parents had it, that number jumps all the way up to 70%. So what's really going on here at the skin level? Honestly, the best way to picture it is like a poorly built brick wall. Healthy skin cells are packed together nice and tight, like bricks with solid mortar. It keeps moisture in and irritants out. But with atopic dermatitis, it's like there are gaps in the mortar. Moisture gets out, which causes that awful dryness, and irritants and allergens can sneak in, which causes all that inflammation and itchiness. Now, here's something pretty fascinating. The location of atopic dermatitis tends to change as we get older. In babies, you'll often see it on their chubby little cheeks or the outside of their arms and legs. Then, as they grow into kids, it famously moves into the creases, the crooks of their elbows and the backs of their knees. And by adulthood, it often shows up as that thickened, leathery skin we talked about, usually on the hands and neck. Okay, so if atopic dermatitis is that inside job, our next big category, contact dermatitis, is all about the outside world. And just like the name says, this type of eczema is caused by something your skin physically comes into contact with. And this one breaks down into 2 main flavors. Now, you might find this surprising, but a whopping 80% of cases are from simple irritation. Only about 20% are because of a true allergy. And that's a really important difference because it completely changes how you deal with it. This chart just lays it out so clearly. Irritant dermatitis is just direct damage. Think about a heart cleaning product. If you get enough of it on your skin for long enough, anyone's skin will react. It's not an allergy, it's an injury. But allergic dermatitis, that's totally different. That's your immune system freaking out. Your body has to have been exposed to something before, and then when you touch it again, boom, the rash shows up, usually a day or 2 later. Now, while atopic and contact dermatitis are definitely the heavy hitters, they're not the only ones out there. Let's just quickly touch on 2 other common types so you have the full picture. First up is seborrheic eczema. You can think of it as dandruff's cousin. It loves oily areas like your scalp, face, and chest, and it's often linked to stress and a common yeast that lives on our skin. Then you have steatotic eczema, sometimes called dry skin eczema. You see this a lot in older adults, often on the lower legs, and it looks like a dried-up, cracked riverbed. It gets way worse in the dry winter air. Okay, so we figured out what eczema is and the different ways it shows up. Now for the most important part, right? What in the world can we do about it? This next bit is all about how you can take back control. Look, if you remember one thing from all of this, let it be this. Proper hydration is everything. It is the absolute cornerstone of managing almost every single type of eczema. Remember that faulty brick wall? Well, moisturizing is you going in and patching up those gaps. It is the most critical step. It is non-negotiable. So here it is, your action plan. Step 1, play detective. Figure out what your triggers are. Step 2, moisturize, and then moisturize again, especially right after a quick, lukewarm shower or bath. Step 3, use the medicated creams your doctor gives you to calm down those angry flare-ups. And step 4, do whatever it takes to break that maddening itch-scratch cycle. And of course, this is absolutely crucial. Please partner with a healthcare professional. They're the ones who can give you the right diagnosis and create a treatment plan that's safe and effective for you. This is especially important for kids because doctors are extremely careful to avoid treatments like long-term oral steroids that could potentially affect a child's growth. Wow, we've covered a lot of grounds, from all the different types of eczema to a solid action plan for managing it. So I'll just leave you with this question to chew on. Thinking about everything we've talked about, what's just one small change you can make starting today to take better care of your skin? Maybe it's just remembering to moisturize after you wash your hands. Whatever it is, you've got this. Thanks for tuning in.